What Drives You is brought to you by Ziglar, your premier source for equipping life and leadership coaches. Visit Ziglar.com and let them inspire your true coaching performance.
Yeah.
Welcome, Driven community. Thanks for joining me for this conversation. We all want to live a driven, inspired, and peaceful life. And together, we're learning to drive further and enjoy the ride. This is What Drives You. I'm your host, Kevin Miller. This is a What Drives Your Health episode, and I titled it, You Don't Have a High Blood Pressure Medication Deficiency. It is caused by something. It's kind of a blunt headline. It's just relevant, though. I mean, we could say that concept regarding any medication, but high blood pressure medications have become one of the most common prescriptions in our culture. Current stats put about 50% of Americans on high blood pressure medication, with people needing it at younger ages all the time. And like many ailments, we accept this as a norm, and taking blood pressure medications is now just like having your morning coffee or your tea. It's just a norm. But at the core, there is a reason that our blood pressure is high. High blood pressure is a symptom of the body not doing what it's supposed to do. Or in truth, the body's trying to, but it can't overcome something that we're doing to it or we're not doing for it. There are actually little side effects to the medication itself, but what else is going on that's not supposed to be? Now, being overweight is a primary correlation, but then you have seemingly fit, well people like actor Will Smith a couple years ago who found out or he came to the understanding he's on high blood pressure medication and he shouldn't really. People wouldn't have thought that. So how does that happen? Well, here I'm joined by my friend, Randy James, medical doctor and functional medicine expert, to really try to unpack this issue of high blood pressure medication and help you understand what would be most helpful for you. Here we go.
So in reporting about my own health, I am successfully sleeping with my mouth shut.
With the help of tape, or
yeah, with the help of tape. Yeah, but I mean, I've literally watching the adventure movie, and they duct tape somebody's mouth shut and tie him to a chair, and I've always said that's it. I'd die right there because I can't breathe through my mouth or my nose well enough, and I would die. Well, here I am. I don't know. The majority of my life, as I know it, mouth breathing. And we read the book Breath by, what was it again? James Nestor.
That's right.
And it's taken me a while, and I'm sleeping silently for one thing. So my
mouth
wife can testify
closed and not snoring, not chunky breathing through your nose.
No, just
that. Me too. Over, I guess, 6 months now. And when we had traveled, I had not brought tape with me. And I think I kept my mouth closed.
Okay.
So that was kind of encouraging, but you don't know.
Yeah.
I've been thinking about oral health, and if people say, well, what's the worst thing? And, or the best thing, like you do, what's the pillars? What can I do? And one of the things I would say is less carbs on your teeth.
Yeah.
Obviously brush your teeth. Okay. So brush, floss, and less carbs and less air.
What do you mean?
Keep your mouth closed.
Oh, yeah. Less everything. Don't eat. Don't breathe.
Less air.
And it was the show we did called How to Breathe. And we talked about this book by James Nestor. And basically that. It's, advocating nose breathing and not mouth breathing, which we, as a culture, mouth breathe more, can't breathe through our nose because of lots of different reasons. And yeah, for me, my gosh, if I'm going to eat a bunch of sugar at night, it's going to make it hard. But anyway, so there's a testimony. My other one, check out my shirt. You see it?
Oh, do the do.
Yeah, I did a duathlon this last weekend. I think I got 6th place in the men. I think the 5 guys in front of me all had 20 years less on me. And I was proud of that. So I'm the one guy with a little bit of gray showing, and just grateful for, ability, mobility, for the health.
Capacity.
Yeah. There you go.
Resilience.
Yep.
Almost on the platform.
Almost on the platform. Well, speaking of capacity, so blood pressure. Somebody had asked about this. A listener asked us to do a show. We did one recently on thyroid and got so many good responses for that. So So let's talk about this. So as I often do, start with the stats. CDC says nearly half of adults in the United States, 108 million, that's actually 45%, have hypertension defined as systolic blood pressure, and take a medication.
Well, you have to systolic blood pressure over 130, I'm assuming.
Yes, exactly. Okay. Exactly, over 130. So I was, again, layman's terms for those who, like me, are not a doctor. What is high blood pressure? It's called hypertension. It's that the blood pressure is higher than normal. Your blood pressure changes throughout the day based on your activities. Having high blood pressure measured consistently above normal may result in a diagnosis of high blood pressure. What are the symptoms? Most people who have high blood pressure do not have symptoms.
That's right. The silent killer.
The silent is really? Okay. In some cases, people have high blood pressure and have a pounding feeling in their head or chest, a feeling of lightheadedness or dizziness, or other signs. So again,
and those guys are they're very high blood pressure.
Oh.
So by the time you're having symptoms from high blood pressure, you have significantly high blood pressure.
I remember a patient coming in here, a new patient one time came in. Now, this is when you and I started working early, and they're looking at the big picture, but you looked at the guy and his wife saying, I think it's probably, and you said, you took your blood pressure. You need to be on meds now.
Yeah. The ticking time bomb, right? The walking time bomb. And that is something I want to encourage people as they're listening to us, thinking about functional medicine, is you can't forget the things we already know about typical medicine. Like high blood pressure is still bad. Now, it doesn't mean that you're born with a deficiency of lisinopril or amlodipine or these medicines, but it doesn't mean that it's good to skip your medicines and then go off and try to eat right for a few days in a row. There's a value to get the blood pressure down. And I don't want people to think that natural is better or something. I mean, thank God we have
natural is better. But if you're in an acute place,
if you're already, whether you're 30 or 80, if you're already 200 over 120, let's not talk about your diet. Let's get the blood pressure down. Right. And then talk about these other things.
Right. Again, because I'm saying that's an acute thing. So if I slice your arm open right now, you're going to say, no, I don't do Band-Aids.
That's right. God did not make me with a deficiency of Band-Aids.
Actively bleeding, let's do a Band-Aid, but let's figure out how to quit getting your arm sliced so that you're not
That's
bleeding. Right. Well, and I looked at, what is untreated high blood pressure lead to? And of course it says heart attack, stroke. Brain clogs. This is bad stuff. So why do we get high blood pressure? This is CDC stuff for the most part. Why do we get, this is what the CDC says, common factors that lead to it: a diet high in salt, fat, and or cholesterol, chronic conditions such as kidney and hormone problems, diabetes, and high cholesterol, family history, especially if your parents or other close relatives have high blood pressure.
Okay, you're giving me high blood pressure.
Okay.
This is
CDC, but I know. That's why I wanted to start here, because this is where the majority of us regular people go and look at Dr. Google. Yeah. And this is what it tells us.
Yeah.
Oh, okay.
Yeah, it's family history. It's my dad's fault. My dad had it, therefore I'm going to have it. Salt? Really? Are we in the 2000s?
This is, but 2021, yesterday afternoon in Google, I put in why, and this is what
comes up. It's frustrating. And at the same time, people can't hear me as saying no, salt doesn't matter for anybody ever. It's just such a low priority when, we are now dealing with the consequences of the last 40 years of people trying to do a low salt diet. Yeah. So people think salt is unhealthy. So people usually younger than you and I, our age and younger, because their parents all have hypertension and they've grown up with dad, we can't have salt on the table because dad's got high blood pressure. He still takes his medicine. He still does whatever. The low salt diet doesn't help. And now we have a whole generation of people not doing salt, and therefore they have a thyroid epidemic because they have no iodine, because most people are going to only get iodine from salt. And I'm not saying go out and have a high salt diet. I'm saying freely salt your food. But if you're having a problem with sodium, with salt, it means you're eating too much processed food.
Yeah.
Make your own food and salt it yourself with a good quality salt that where you have an awareness of iodine, right? If you're doing sea salt, you're not getting any iodine. You've got to be aware of that. And salt to taste. The likelihood, if you're also sleeping and exercising and doing all the other things that we talk about, that salt is going to be your trigger towards hypertension is very, very low.
Okay, so let me make layman's terms. So the grocery store over here, if I go in and I go to the middle aisles, all the aisles in the middle, and I'm eating out of there, out of boxes and bags and whatever, processed foods for breakfast, lunch, dinner, snack, and they have salt. They also have an ungodly amount of other chemicals that you can't pronounce in them. That's bad. That's not going to help.
Right. It's bad on many, many fronts.
Yeah. Salt and chemicals and lots of different things are going to be in there. If I eat from the outside aisles, the outer aisles, the produce, the meats, the dairy, the whatever, all the stuff that's on the outside, then add salt with iodine, I'm good.
You're more likely to be good.
Okay, good.
That's right.
Okay.
It's these lingering truisms that even the CDC would, says salt and family history. And it's like, well, it gives a person who's 35 and the doctor says, gosh, your blood pressure's a little elevated. Oh, well, my dad had it. And it's like, yeah, let's just go ahead and start you on a medicine because we want to protect your heart. You don't want to die of a heart attack. And the guy has to think, okay, and so now you're tied to this version of American medicine from now on and forevermore. And even worse, you think it's good. You think, well, thank goodness I have good benefits through my work. And you're paying $1,000 a month for a $5 pill, $5 per month.
Yeah.
And it just...
I remember a guy saying that to you when you transitioned from a pseudo traditional practice to this. Now you're going to pay cash for actual deep work and getting well, and a guy saying, I'll just take my pills.
I'll just take the pill.
Yeah, which we laugh at, and yet I do it to a lesser degree in other areas.
We're all on the spectrum.
We're all on the spectrum. Well, you say in family history. So let's go back to that family history. We did a show on genetics. I want to give credit to that. We did a show to talk about the reality that you actually gave more credit to genetics than I expected you to, but then also how much gravity should we give them? But now coming back here and saying high blood pressure, family history, when you're saying that in frustration, I'm hearing more than family history, it's family habit.
Yeah, I would agree with that. That the father to son or parent to children connection has more likely to do with how we ate and exercised together as a family over the course of time in our zone.
Yeah.
We're Midwestern, we're on the coast, we live here, we live there. And that has likely more to do with it. And now we live in an age when most kids don't live in the same city as their parents and that kind of thing. And we're spread further out. But we're still living in the same culture, right? Like life in Denver is not that much different than life in Chicago. And so it's the environment that we find ourselves in that's much more likely related to the family history connection. And at the same time, is there family history? Absolutely. So break the chain, right? Like we would say, don't live like people in your past, which is easier said than done. But if all you say is family history, then you've got nothing to do. Because you can't change your parents, you can't change your genetics. You can change your epigenetics, the environment within which you are raising your own genes. You can change that.
And I just did a different show and kind of talking on this, and we talked about that you have a propensity, possibly a predisposition that you feed and further, or you starve and limit.
Okay. Yeah. You nurture on one side or you starve on the other side.
Yeah.
So hypertension down this pathway, one of the things I wanted to bring up is we say high blood pressure, we say hypertension, and everybody thinks, oh yeah, that's old people associated. And why do we even think about that? Why do we measure it? How long has it been around? And how to think about it in terms of layman terms. And so, because it's also quite difficult to get an accurate blood pressure. People don't really know that. They sit in the chair at Safeway, if you remember that chair that was there for a while, or you go to the dentist, to the doctor on your once a year checkup or whatever. But it's actually, so what is blood pressure? What is the tension within the blood, and why do we care about it at all? And at the end of the day, because you don't feel it, the only reason we measure blood pressure and cholesterol, because it doesn't make you, if you have good blood pressure, Do you feel smarter, younger? Do you run better? Are you a better husband, father? Do you work better? And I would say, well, if you have symptomatic high blood pressure, then yeah, you would. But between normotension or normal blood pressure and symptomatic high, there's usually decades of time and you're not going to notice any changes.
You know, I mean, I keep coming back to resting heart rate just because I look at it as a measurement of my own, wellness, how I'm doing. If I have high blood pressure, am I by proxy going to have a higher resting heart rate? Generally?
Not by proxy.
Really?
Well, the thing that would cause a higher blood pressure is also a thing that would likely cause a higher heart rate. They're not, they're correlative.
Because again, layman's terms, I'm just thinking your body is working harder, right? Isn't your body sitting there as a machine? It's working. So if I'm laying there at night, instead of my heart rate being at 45, boom, 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 at rest and healing itself, recovering, it's working harder to deal with whatever. Okay.
Yeah, but it's working harder as a consequence of all of the things that led to high blood pressure are all of the things that would have also been leading to high heart rate and high cholesterol. And the reason we measure this, and even, your CDC measurement of hypertension, and I saw the map, right? The red map of it's worse in the Southeast and here and there, is because it's heart attack, stroke. This is what kills most people on the planet is the combination of blood pressure, cholesterol. Why? I'm putting you on the spot. Yeah. Like, what's so bad about hypertension? What does it do?
I don't know.
Yeah. And most people don't. They're like, oh yeah, high blood pressure. Okay. But then when you go, everybody can conceptualize high blood pressure. It's so common, but almost nobody will say, oh yeah, what does that do? If you hurt an Achilles tendon or something, you're like, oh my gosh, I can't walk. Here's the direct consequence. But within the blood pressure realm, people don't associate it with, well, what is this doing? And I think it'll bring it home for people to say, okay, as you conceptualize what this is doing, because as I'm reading and studying and I'm like, oh my gosh, this is going on in me right now. Like right now, my blood pressure is a little bit higher than it could have been. Yeah. And what's that doing? So what is heart attack, stroke? Why does heart attack, stroke happen? And again, people don't think about this because it's old people. It's our die over here. And I said, that's not what's happening.
I think of The Godfather, and it's a big, and this is terrible, but it's this huge Italian guy with a stogie and a drink.
Just go kill him.
And a drink. Yeah. Sitting there eating pasta covered in sauce and weighs 300 pounds. And he take his blood pressure medication and Ticker's about to quit. And that's it. And then, this came to light for me watching the Red Table Talk, which was September 2019. So Will Smith and his family do this Red Table Talk on YouTube, or I don't know where it is, but somebody told us about it because Dr. Mark Hyman was on there. So they did it, and he came, and it was this confession to his family. So it's Will Smith. I mean, the guy's, 6'4". Most of the movies I see him in, he's pretty built. He got big muscles, smart guy. I mean, king of the universe. And he comes on there, and in the course of this divulging to his family of health problems he has, we find out he's been on high blood pressure medication for like 2 years. And he just didn't think anything about it. Hey, your blood pressure's high, take a med. He's Will Smith. He looks good.
Wasn't it longer? I remember that. I thought it was 10 years. Oh. And then even over the course of him training for Muhammad Ali, and he was fit.
And he looked fit. That's what he said. He learned how to look fit, but apparently he wasn't internally fit.
Yeah. So
he's not the Godfather.
There we go. It's not the Godfather picture.
He's over here juking and doing all his workout and gaining muscle and whatever, and he's on high blood. That didn't calculate for me. Well, how does that happen?
So that, I'm hoping, translates to people listening to say, oh, it's 108 million people, adults. That's half of us adults, almost. And on the spectrum of where we would say blood pressure. And so I want to put the picture in people's mind, what this is doing on the inside of the arteries. And then also, okay, well, how do we think about it? Like, how do we measure this? Like, you're measuring your heart rate. Are you measuring your blood pressure? Okay.
No.
Yeah. So you should be. Okay. And we all should. So, but how often and how do you do that? So why do we care about this? Well, because at the end of this road, Will Smith, he's still doing a life. He's still successful, but he's on a medicine. And over the course of time, he's less likely to be as successful as he could be over time. What you and I talk about over time, resiliency, capacity, and those kind of things. He would more likely have been a better Muhammad Ali if his molecules and body had been performing a little bit better, but they weren't. And of course, we don't know, right? We cannot. It's theoretical.
Well, you say that. You have evidence-based. Can't you go with that? I mean, if we look at it statistically, we'd say,
there you go.
Okay, maybe he was the best Muhammad Ali, even though he was the muffin man, is what he was saying, and eating all this junk. But at some point, I think he's probably as older than we are. He is going to encounter a limitation, an incapacity quicker than he would.
Right. The statistics, the likelihood that his resiliency would be curtailed sooner rather than later is there.
Yeah.
And therefore, an aspiring Will Smith, and even in the show, he testifies to the fact I am willing to change in order to become the kind of guy that doesn't need a blood pressure medicine, because what's going on in your arteries is going on. It is happening. And so pressure is, and I keep going like this because picture an artery. Mm-hmm. So on the inside of that artery, and now your blood pressure. So the pressure is pushing against the walls of the artery more than what it would have been doing. That's blood pressure.
Because of junk in the arteries?
It's why the blood pressure is higher is very, very complex. So let's come back to that one. Sure. But what's it doing? Why do we care? So if you look at heart attack, stroke, and I can't remember if we've talked about this on the show, but it took us 40 or 50 years to figure this out. It's not that your arteries clog up. That's not how a heart attack, stroke happens, or that people think
what I thought.
That there's gunk in there. Yeah. And there is a plaque.
Uh-huh.
Okay, but let's think about it. And so a good analogy is your hand. Your hand, if I have your hand, you're going to have bigger calluses than me because you're cutting wood and doing stuff with the kids and all of that. So there's friction, right? There's pressure. You're grabbing a axe handle and doing stuff, or a hammer or whatever. And over the course of time, we all have some degree of calluses right there on our hand because of it's not that the hammer put a callus on your hand. Your skin is responding to a stimulus in a way that says we got to protect ourselves.
If I held it motionless, it wouldn't do anything. It's the movement and the friction one against the other. Okay.
Over time.
Okay.
Imagine that going on with inside the artery.
Okay.
All right. Over time, there's friction. And let's just say friction is life. So with inside the artery, everything that you're putting into your artery, the pressure that you're putting in there, the amount of hydration, the amount of stress, or the lack of sleep, all of those kind of things.
But is it still like junk in there?
No. No. So it's hitting the edge of the artery. Okay. Now we have to drop in a very important word, the endothelium. The lining of your artery is a single-celled layer. Heart disease, heart attack, stroke is a consequence of the function of the endothelium. This is it. It is not plaque it is plaque, but the plaque develops because of the metabolism of the endothelium. The endothelium is a single cell. It's responding to the environment of the blood. What is the blood telling the endothelium? What's the endothelium telling the blood? Right? This is going on every millisecond, every time in your brain and in your body and in your heart. And so now imagine the skin of like a peach, a succulent, delicate peach skin. And if you drop it, you get a bruise. Again, or just even in your own skin, or back to the hand, the friction, there's two things, the hammer and the ability of the skin to respond. If you did that to a corpse, there would not be the development of a callus.
Right.
The skin isn't responding. So the endothelium responds to what's going on in the blood, and the consequence of that, if you go underneath the endothelium, what's the very next cell layer that you see? The immune system. The immune system is responding in an inflammatory way. We talked about inflammation a lot and the inflammation resolution. So here comes the friction of life. Like in this case, pressure. Oh, wow, this guy's nervous about something. His name's Kevin Miller. He's getting ready to go do a speech and he's nervous. His blood pressure is going up and the skin is responding to that. It's friction on the side of the endothelium. And then you do your speech and you relax and you go back down and the blood pressure drops back down and the skin is responding to that. And when the blood pressure is higher, there's more friction per se. The skin or the endothelium is responding to that in a way that contributes to the development of what we call then a plaque. Okay. It's a callus on the inside, but it's not fat. It's not junk. It's not gunk. Your body is responding to the information that you're giving it. And you're giving your body the information that leads to hypertension.
Okay, because I'm back to my mafia guy, and I'm sitting there thinking one more bite of Stromboli, and boom, he finally packs it in. There's enough gunk, and he has a heart attack. And yet, the depictions that we see, I haven't seen it myself, but so often when somebody has some traumatic event, and their anxiety comes up, and boom, it causes a heart attack.
That can, right? You can die of a broken heart. This happens more. Takotsubo's congestive heart failure or something like that, but more often women who will be in a stressful situation that's just beyond the pale of whatever, and they get nervous and the hormone response happens so strongly that it can actually occlude the blood vessels, and which is what a coronary event is, and you get a heart attack, an infarction, which means the coronary artery closes off either from, clamping down in that case for somebody being so nervous about something, or what happens within, have you ever heard of a gymnast? Have you ever seen a gymnast's hands?
Yeah.
Like if you're on the high bar, you're swinging on your hand, and with even the typical gymnast, and they weigh 150 pounds or whatever, but that's about 600 pounds of pressure. When you hit the bottom, you've got to be holding 600 pounds of pressure. And so it's rubbing your skin. So they have huge calluses. Yeah. And oftentimes they'll rip. Yeah. So the callus, have you ever ripped a callus? Uh-huh. Okay. That's what causes heart attack, stroke. Okay. It's not the callus gets bigger with inside the artery and eventually closes off. No, it rips off. Wow. And that's the clot that goes downstream, causes heart attack or stroke. All of that to get a callus or a plaque, atherosclerosis within your artery, that process takes about 30, 40 years, right? It begins in your teens. We're not eating well. The blood pressure's going up with genetics and salt and stress and blah, 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 blah. And then people in their 50s, 60s, 70s have these events happen.
And that feels, that seems reasonable. That's what I expect is that, well, back to everything, we're growing it. Yeah. So we are growing a heart attack. I have not ever experienced somebody come along and say, somebody who are 22 years old and fit and trim, and boom, out of a sudden they caught a heart attack. That's one that I'm sure there's always exceptions, some rare case and some deformity out there. But for the most part, we do see that this happened over such a long period of time. Though, again, I'm usually used to seeing the signs. You can see the signs. On Will Smith over here, I don't see the signs. And so
you just didn't look in the right spot.
Okay. Well, we assume though that similar things between my mafia boss over here and Will, they're doing them. He's just doing some good things as well to offset it maybe, or to hide it. I don't know.
Well, like we say, everything's related to everything. And the carotid ultrasound that we do. Yeah. So remember the scale, the pink line and the blue line of. So explain. So this is an ultrasound of the carotid artery. Yeah. And in this case, we're measuring what I just talked about. How thick is your callus, so to speak, on the inside of the endothelium, and it's measuring the thickness of the arterial walls. Okay, well, if it's thicker, then presumably this process is going on. And
which I want to pull out. I love that measurement. That's one of those things that says, okay, because when I did mine, I was whatever I was, 47 or 48, and it did the measurement and said, yeah, your measurement is the health of a 35-year-old or something like that. And of course, I want my insurance company to go, oh, we're going to lower your insurance because of that. And
I would say big whopping deal.
Really?
Because when you were 45. This is the equivalent of a 60-year-old Okinawan.
Oh, well, okay.
Or go to any blue zone. Who cares what the average American
That's true.
carotid thickness is? I don't want to know what The average American is hypertensive. That's what we just said, is 108 million Americans. So literally, who cares? I mean, but at the same time, it's a data point that, okay, we're trying to understand this. What I really want to know is what's the carotid intima media thickness of the Okinawans.
Yeah.
In fact, I'm going to go look that up.
Which, okay, so you're saying that's out of the Blue Zones book that we talk about so much by Dan Buettner, of the healthiest people. And that was a culture, that's a culture, along with what do you have, 5 different cultures around the world where they were, in essence, the healthiest. It was, the focus at face value was where they lived the longest, but it was they lived the wellest. They were also just healthy.
And so by
quality and quantity.
By proxy, then what is that measuring stick? And it would be very interesting to know how thick those guys' arteries are. And my point for bringing that up was the increasing thickness. When does it begin?
Immediately. I mean, at
essentially
birth. I don't know.
In the teens. That's when you can start to see. And there's the average girl line, the average boy line. And then at what point does that increasing thickness equal atherosclerosis? And then we talk about that all the time. We're all on the spectrum of this increasing thickness.
I mean, well, and as we go through that, and you and I, we've gone through, adrenal fatigue and dementia and Parkinson's and things like that. And of course, from a functional medicine standpoint, what causes the fruition of those pathologies? And we would say, well, it's everything. Your sleep, your eating, your, blah, blah, blah. But where are some primary things that cause that manifestation? Like with Parkinson's, you said environment was a big thing, right? Exposure more so than diabetes, where it's more of a an intake type thing. Mm-hmm. So to this too, to high blood pressure, because as again layman's terms, I tend to think mainly of fatty. I mean, by culturally, they're eating fatty foods, they're overweight. They're at risk for high blood pressure, which the CDC, if you look through their stuff, that is primarily what they'll come to is weight. They'll say the biggest causation is being overweight. And it was interesting. I happened to see this. They said, even if you got 2 guys that both weigh 50 pounds, they're both 50 pounds overweight. Okay. They both weigh 230 pounds and they're 50 pounds overweight. If one of them, however, is active and is overweight, but is maybe eating better, is active, whatever. Now this is CDC. I'll see what you say. They said they're not that much better of a risk. Cause if they're overweight, it's still, it doesn't change that much. So being overweight, out of shape, or overweight fit doesn't seem to matter so much. When it comes
to which guy's going to get
high blood pressure. Yeah. If they're overweight. So weight is what they showcase it to, which again,
I would disagree.
Okay.
With a nuance there. And in fact, this is a problem. If we haven't done a show on obesity or on overweight, most people will think that their other comorbidities that are caused, like hypertension, are caused by being overweight. And I would argue that they're both consequential. And then once both metabolic processes are happening, they both make each other worse.
Okay.
So it does overweightness cause hypertension? And I would say it's whatever caused overweightness is also going on in hypertension. And so it's kind of like 2 streams with different consequences. And sometimes that happens in both people. In fact, they often travel in pairs. Overweightness, diabetes, hypertension, high cholesterol.
So if I'm eating the types of foods,
right?
If we just look at that, let's say eating types of foods, and I'm having high stress and anxiety, and I'm not recovering, and I gain weight. Those things that help me gain weight are also the things that help me have high blood pressure.
Yeah.
Not so much the fact of if I took 50 pounds of flesh and smacked it on your body, you wouldn't say, oh, now he's got high blood pressure.
Right.
It's the things that added to that.
Even though people do think that, like, oh, you got to push all that blood through 50 pounds of extra. That is true. So now the weight is making the blood pressure worse.
Okay. So Will Smith didn't have that part. He was apparently in his testimony dietarily and maybe stressed.
Well, and let's say another big important thing is it is more common in African Americans. To absolutely, genetically, absolutely.
I think Mark Hyman talked about that.
Yeah,
that's right.
Yeah, sure. But here's what we don't have. We don't have a blue zone of African Americans.
What do you
mean? We don't have a control group of African American culture that in America I'm getting my words confused because Black people, African Americans, if they live in Africa, I would call them Africans.
Yeah.
But let's just say a genetic Black race.
And over there, I would think they probably like the Ethiopian elite runners that lived with us, doing their high altitude training, probably were not at any higher risk of.
I would presume
that they are here in America.
I would presume
it's a cultural thing. It's a different culture over there. Yeah.
That's right. But when those different cultures move to America, they do have, by race, and now we're back to the genetics, a higher risk. This is true. That's why, the map of America and the Southeast having more hypertensive, and part of it is race. But the problem is people then say, oh, it's genetics. Yes. And we don't have a control group of people of African American people that in America, say in the middle of, I don't know, Montana or whatever, that have a different nutrition, exercise, sleep, mind, body, stress habits in order to say, oh, when this racial group gets put into this environment, the risk goes away.
Yeah.
So is it the environment or is it, of course it's both.
Yeah.
So here we are with the idea that we have to deconstruct and say no. In fact, just yesterday, 50-year-old woman, calling to be a potential patient, and she said the words, if I could just lose weight, then all these other things would go. And I said, well, even if you don't become a patient, I can relieve you of that burden.
Yeah.
Yes, you should lose the weight, but that isn't going to be the likely solution for everything. So that was to Will Smith. The guy didn't need to lose weight at that time. He has high blood pressure. He's pooping literally pooping once a week, I think is what he said. He has all these things that were, I think they primarily came back to diet. There were some lifestyle things, but he was doing those things, but he was also over here exercising and running and doing things. So he did not get fat. He did not showcase what we would expect for hypertension. And I guarantee you his doctor said, well, it's genetic. You're African American. We expect these kind of things. And
you might have even had the doctor say, well, gosh, you're not overweight. So who knows? You're a fluke. Here's your meds. And but I also was so interested that here you've got this incredibly intelligent guy, and he didn't know better than to question it. And he talks about that in the show. I'm not picking on him. He talks about that. He says, I didn't know. He says, I can't believe
we don't know what we don't know.
I ate food for pleasure. That's all. Food to me, that was it. It was for pleasure. And that's what changed. And now he's, and again, folks, it was September 2019 is the show I'm talking about. December, I think, if I've got it right, 2019 is when they did a follow-up show that showed the results of their blood work. And it was an advanced diagnostic from a functional medicine standpoint by Dr. Mark Hyman, just what, very similar to what you do. And they made big changes in their diet, in their nutritional supplements, in their sleep and anxiety, and it was really neat to see it come from that level.
Yeah, especially through the lens of somebody that we as a culture would say, "Oh, the guy's got it all together," and yet he didn't know. One of the things that I think people don't know also is, how do you measure blood pressure? How do you know what your blood pressure is?
You put the cuff on is all I know.
So measuring blood pressure is actually quite a big pain in the rear, because so many people get diagnosed with, oh, your blood pressure is high from one measurement, but like even the CDC, the very first thing you said is your blood pressure changes throughout the day depending upon what you're doing. So if you're running, it should go up. If you're under stress, it should go up. If you're going to give a speech, it should go up. Just with your heart rate and things like that, you're performing and your blood pressure.
If I come in to see you as a doctor and I'm nervous about being here, I feel
white coat hypertension.
I'm afraid of what you're saying. You're going to take my blood pressure and it's automatically going to be jacked.
That's right. So how do we know actually what the blood pressure is? And it's actually quite a challenging thing, especially like a lot of our patients don't want to be on a medicine. So how do we know what the exact measurement is? So this is what I tell people. And so for people listening, this is doable. These days you can buy a pretty good blood pressure cuff that's automatic. You want to get the one that goes above your elbow, the bigger cuff that's automatic for, $50 kind of a thing. And I think every home should have one. Just like you've got a toothbrush, you've got things that you've got a fancy watch that you paid a lot of money for in order to give you these kind of things. But it would be good for us to know at 50, what's your blood pressure? And here's how you measure your blood pressure. So you buy a cuff, and then 1 week out of them in our case, once a year to do a week-long blood pressure check. And this is how you would do it. At least twice a day, at different times a day, after at least 3 minutes, maybe 4 of rest, measure blood pressure. So what most people make the mistake of is they put it by their bed, they measure it in the morning, they measure it at night. Meaning we don't get a postprandial or after you eat, after exercise, we don't. Or they come, it's at the dinner table and they come in a huff and they're sort of whatever and they don't rest. So you want to give yourself 3 to 5 minutes of just sitting there, arm at heart level, so you're not having it up here or too low or laying down or whatever. Do it the same way each time. Measure it 2 or 3 times a day at different times a day for a week and average it. That's your blood pressure. Right? So if somebody comes in and we measure it high, I say, okay, look, it's high, but I don't want to be on medicine. Now, again, if it's 180 over something, then we're going to have a different conversation. So before we go there, what's high blood pressure? What's the number that you would think of as, okay, now it's high?
I never remember. I don't know. Whenever I've had it, it's probably been 2-3 years since I had it done.
What's the famous line that everybody knows, except for maybe you?
Well, except for me, what?
The 120 over 80, right? That normal blood pressure is 120 over 80.
I know they always just say, I'm grateful. I always get, oh, wow, yours is low. It's great.
Yeah. And how much of that is genetic? How much of that is credit to you and doing whatever? And we won't know. That's not the right question. Keep doing those kind of things.
But I did, and we veered off this. I was trying to come to the question of what are the specifics? So if somebody's out there with high blood pressure or not wanting to, again, we could say it's everything, but like with Parkinson's, you pulled out. No, there's environment has a big thing.
Specific things.
Is there what are the specific advocacies or culprits?
We veered off the actual what is high blood pressure, and then we'll get to the specifics. Everybody's on the spectrum.
Yeah.
Okay, so this is an easy.
We all have blood pressure, otherwise we're dead.
That's right. If you're 0, you're dead. If you're 500 over 300, you're dead. Right? That can't happen. So everybody's on the spectrum. So where then do we draw the line and say, oh, that's too high? You get
in America. I assume that line is higher than it used to be.
Well, now we have the word pre-hypertension.
All right.
Right. So
pre everything. Everybody's pre-diabetic and
So 120 over 80.
You said pre-death?
Yeah. And that's my, when we sell supplements, I think we ought to say, hey, everybody, you're pre-death.
You are pre-death.
Stave off death one more day.
Yeah.
So on the spectrum, so 120 over 80 and now, so JNC 8 just came, Joint National Congress number 8. So there's been 8 national congresses on the definition of high blood pressure, right? And it took them 10 years because it's so highly debatable. They couldn't come down to what do the experts think that here is where blood pressure is the, pre and the pathologic mark, and here's where we put a medicine in and all of that. So now depending upon age, sort of 130 over, well, again, depending upon age, they moved it up. 140 over 90 used to be. Now, if you're younger with no comorbidities, it's even 150 over 90 before you would start a medicine. But if you have diabetes, it's 135 over 85 if you have diabetes or other heart disease or something like that. All of that is based on pathology. That's where I get frustrated is you're making lines based on comorbidities. What about you and I? Where is awesome blood pressure?
Yeah.
And I would say this is the way risk begins. You are putting pressure on the system. Like think about driving. Are you putting your life at risk? Risk begins when you start moving the car.
Yeah.
And It's higher if you don't have a seatbelt on. It's higher if you drank a glass of wine.
If you're
it's
doing 120.
If you're doing 120, you're higher. Risk begins at 115/75.
Okay.
So to you as a guy who says, I want to be, where's the ideal blood pressure? Okay.
We should have brought a cuff in here to do
110 over 70. What about 90 over 60? What about 85 over 40? If you show up with an 85 over 40, they're going to go, are you okay? And I would say the lowest blood pressure is ideal with no symptoms.
Okay.
Okay. So as low as possible with no symptoms. But what if you can't feel the symptoms, right? Like at 85 over 40, you might say, oh, I'm fine. Well, are you actually getting blood pressure pumping through your little bitty toe down here in order to stave off?
I would say you're fine,
problems?
but if I take off sprinting up that hill, am I going to pass out?
Are you going to pass out? That's right.
Yeah,
Do you have capacity?
Right.
And my family, my mom, who's not overly on the healthy side, always has low heart rate, low blood pressure. And so there's probably a genetic thing going on there. And, but she would not be able to sprint up that hill. And so for people to, because everybody wants to boil down, like and I would say 115 over 75 above that is where the risk begins. Risk is now accumulating. So you might say, oh, but I'm 120 over 80. Oh, well, okay. But what if you're 120 over 80, but you only sleep 6.5 hours a night? You're slightly underhydrated. You're not really exercising like you should be. All of these things now go back into friction on the inside of your artery. Yeah. And pressure is a major, major friction. So just imagine we put that, hammer in your hand, and now some kind of vice grip comes along and squeezes your hand down harder on that. The amount of pressure that your skin has to respond to is more.
Right.
It's going to build a bigger callus. Imagine if you pick up a hammer and for whatever reason somebody coated it in sandpaper, and now your skin has to respond to that, right? Mm-hmm. All of those things are the complex process that goes into atherosclerosis that equals heart attack, stroke. So for people to say, and I've asked 100 people, they're on the blood pressure medicine, we're going along, and I'm talking to them, I'm like, well, why are you taking that blood pressure medicine? And they all hitch. And they say, well, I have high blood pressure. Yeah, I know, but what's your goal? I don't know. The doctor gave it to me. Your goal is to not have a heart attack or stroke. That's the only reason why you're putting that pill in your mouth every day. It doesn't make you younger, smarter, better, faster. You're not accomplishing, you're just staving off.
Okay, so let me ask that. So if your blood pressure is 130 over 90 or something like that. Now I take
and you drop it down. Yeah.
And I drop it down. So I just took away the friction. We're good.
You reduce some of that friction. That's right.
I got it down to 120 over 80.
That's right.
I'm good. Why not just take that blood pressure?
And that's exactly what our culture says. Take a little blood pressure pill, take a little cholesterol pill, take a baby aspirin every day, take all these things to lower the friction. You and I are saying, or put a little more water in there.
Right.
Take your wife out on a date.
But let's come over a little bit. So is that blood pressure pill itself, in and of itself, is it bad? Are the side effects from it that bad? No.
These are things people take for 30, 40 years.
So it's not. So again, but again, I'm trying to back into it. So we're saying, okay, if you can take the blood pressure, take the friction down, okay, you literally have less friction. You're going to build less calluses. That's a good thing. If we're saying the pills, there's not some horrific side effect from it like there may be from other pharmaceuticals. That's good. But then we're still not addressing what is it in your life over here that was causing that high blood pressure, because it's going to have ramifications elsewhere. So maybe you can control.
An analogy here is, let's say you've got the hull of a boat, and the water is touching all along the boat. The friction is there, and let's say there's a leak in the boat called blood pressure, and now it's getting in, creating more of a callus in that other analogy. And you go and take that pill, and you plug the hole. Mm-hmm. But the water is still touching, the friction is touching every other aspect of your life. It'll get in somewhere else.
Somewhere that was my point. It's going to manifest. So maybe you're controlling the blood pressure, but it's going to work to manifest over here.
That's right.
And you are going to get diabetes or
elevated weight.
Okay.
Right? Like we said, weight isn't the initial thing, the initiating process that's causing blood pressure.
And that's where I would go back to Will Smith to say, so here he is, and it seemed like, and I don't remember what his blood pressure was, how elevated it was, but enough that somebody along the line that I'm sure was very ashamed when this show came out.
Well,
gave him a blood pressure medication. He's taking that, and it was taking care of it. It was moderating that.
Well, yeah, he wouldn't be ashamed. This is normal American medicine.
But what we're saying is, but whatever he was doing to cause that high blood pressure, it was eroding something else somewhere.
That's right. And then we have to say, okay, look, we're not saying you can live life in such a way where your hole never touches the boat.
Erodeless.
Where you're erodeless. That's like a boat that's in midair.
Right.
The boat is still made to be in the water, and over time, the boat will leak enough to die. 80 or 90 years, the water is going to get in.
I'm going to die.
You're
all
going
this
to die.
effort, and at some point,
you are pre-death. Thank God. So there's a good way to die.
Yeah.
And all we're saying is, how can we live life in such a way as to keep the leaks out for as long as possible so that I can do the thing that a boat needs to do, called husband, father, mission, and all of these things. And at the end of the day, that's what we want to do. So then your next question that we have to get back to is, okay, how do we patch the holes of hypertension?
If I have high blood pressure, let's start there. If I have high blood pressure, what is your most affirmative action?
Yeah, you keep saying that word. It's a proactive action.
Well, but I mean, like, are you going to go and say, okay, number one, my biggest call to you is go sleep longer, or is it stop eating that, or stop stressing?
Yeah. Okay. So for hypertension, there's two famous cases, and this will then breathe a preamble to say, okay, what are we going to do about this? So two patients come in, one right after the other. One's a 30, let's say he's 28. He's significantly overweight. He plays video games all day long. He eats Doritos and Hot Pockets. He's got hypertension. And I say, look, man, it's high enough. We need to start a medicine and get after this thing and treat the underlying cause. Mm-hmm. And I give him lisinopril, common first, give him, and then the very next patient is a 55-year-old guy, looks like you. He runs marathons. He's a business owner, but he's going through, his business is failing. His marriage is over here. His kids are over here. He's completely stressed out, but he exercises like a fiend. He eats perfectly. What medicine do I give him?
Right. Okay.
The exact same one.
Yeah.
So that to me was one of the beginning places of my transition to functional medicine. I thought, this is ridiculous. Completely different disease processes, causes, completely different. They get the exact same Band-Aid, right? Like if it just is so broken.
But that is true. So you got these two people, and the initial acute care is the same
It's
Band-Aid.
the same.
But now coming back and say, if both of them wanted off of that Band-Aid, then the prescription's different.
We've got to start with, that's right. It's like one guy comes in with the acute bleed, like you said before, and one got accidentally cut with very clean machete, whatever else, and another one came in from a car wreck or whatever else. They're still going to get a Band-Aid.
So they're going to get a Band-Aid, but just to make the differentiation, the young kid who's on the couch playing video games, you may say, okay, first prescription for you after the Band-Aid is get your butt off the couch and go walk. And to the 50-year-old businessman is get your butt on the couch
and take a breath.
Take a breath. Okay.
That's right.
Okay.
So now you can see in this particular case, when you say, okay, give me the 5 pillars of hypertension, I'm like,
Depends on the causation.
It's like, to the guy who's in a war, we're going to say, get in a foxhole.
Right.
to the guy whose dog is biting him, get rid of your dog. It's so, and yet this is one of the reasons why it's so hard for lay people to wrap their brain around blood pressure and cholesterol, the main killers of Americans. We know the problem. We know it.
Well, and look at what you just said with those two make-believe, but that are clients, patients. that for you to do that, if they come, and I want to take a second to pick on the American medical system. If they come in with a problem or for a checkup and they get, oh gosh, your blood pressure is just, jacked. There is not a place. So to not pick on the doc, he does not have the opportunity to dig in and figure out what's going on. He has the opportunity to go, gosh, you got high blood pressure. You need a pill. And he's got 10 minutes to get to the next patient. Right. That's how the system runs.
And that's how the system runs. And let's go one step further because we're smart people. And both of these, let's say it's a 28-year-old MIT student. He's brilliant. But he's still 300 pounds. He still has high blood pressure, still eating Doritos. And let's say
he has areas of brilliance. Health is not one of them.
Health is not one of them. What is the last thing he wants to hear from me?
Change his life. Style.
Yeah. And the same thing with this brilliant CEO. What's the last thing he wants to hear from me?
Yeah.
He thinks he's like, wait, you're going to tell me how to run I'm going to go find a new doctor. Mm-hmm. And he might not say it that way. He might not go, how dare you or whatever else. He already knows he needs to relax and go to bed on time and not have a nightcap. And I mean, all the things the CEO stress people do. Mm-hmm. And the video game guy knows he should eat right and not, do Doritos and go exercise. He already knows that. And so why
not just take a pill?
And why not just take a pill? So $1 trillion system is there to feed into that. It's subconscious awareness of, I remember being told as a resident, so late night, it's not like it was 1940. This was, call it the year 2000. We know the problem, but they won't do it. The patient is not going to do it. So don't waste your time. You've got to take care of other people. This is the standard of care in America. Here we go. And in the military, I got a lot of people to take care of. And when I did actually go color outside the lines, I got sort of my hand smacked. Uh-huh. It's like, you're creating a problem here. You're not fit. You're trying to patch holes the way we don't patch holes. Like I was getting outside the boat trying to, buff up the hole or whatever.
Repair a hole.
I was trying to repair it.
The job is patch it.
And the job is patch it. You got to apply that Band-Aid. And the American medical system does a great job of applying Band-Aids. A great job. But so we're back to this truism. If you are going to get in a car wreck or going to be in, get hit by a bullet or get bit by a dog, you want to be in America. Or live
a lifestyle that degrades your health.
Or if you're going to live a horrific, yes, true. The American medical system is built for you.
Yep.
But if you don't want depression, anxiety, high blood pressure, high cholesterol, obesity, if you don't want to feel stressed out, you're in the worst place on the planet because we'll Band-Aid that thing for the next 40 years and you will never get outside of that. You will never patch that hole.
You will live at a lesser capacity for a shorter time.
You will always leak.
Yeah. Yeah.
So how do we wind up on that one? I was on my high horse a little bit.
No, it's good. Well, you're still you're ultimately coming down and saying, so what is, if you want to not get hot.
That's right. Are there pillars? And I would say this is the quintessential example where the pillars are the things we always talk about.
Yeah.
It is the stress awareness, the hydration awareness, the exercise awareness, the nutrition,
whole foods, and not the processed foods that happen to have the salt that they've keyed in on for high blood pressure.
So don't succumb to the American sort of culture that says, oh, it's genetic, oh, it's salt. And thank goodness you have really good benefits that cover a doctor's visit. And when you have high blood pressure, here's this pill and you can take it and live a long time. That is going to set you up for maybe living a long time, but at a less resilience, less capacity. Your boat's going to be more leakier and you're higher
risk. Because we look at the big things like Parkinson's and dementia and whatever, those are the things that I think are the scariest for people our age and our demographic.
I don't know exactly what you meant right there, but the scariest thing is blood pressure, cholesterol. It is heart attack, stroke.
Well, yeah.
That's what kills people. That's what is the main number one.
Yeah, but I'm just saying the things that lead up to that are also the things that lead up to the other thing, and I'm scared of all of them. I don't want any of them.
That's right. So the proactive, like you say, affirmative way would be, okay, then run face, go a different direction, change your mind.
Back to family history. If you're concerned about family history of high blood pressure and heart attack, whatever, look at the family habits and make sure you're not doing those.
And don't do those. Yes.
All right, friends, thanks for tuning in on this. I hope that gave you some insight on things you can do in regards to high blood pressure if you have that, or how to avoid high blood pressure. Thanks as always to Randy, Dr. Randy James. You can find him at truelifemedicine.com. If you enjoy the show, let us know. Leave us a rating and review on Spotify or Apple or wherever you listen to your podcasts. And you can see these episodes and comment, and I'll respond on YouTube. Find me at kevinmiller.co. You can find me at that same thing, kevinmiller.co, at all the social media where we've got our clips and our reels and whatnot. And check out my book if you haven't, What Drives You, on Amazon. Learn to master your own inner drive. And until next time, friends, stay driven.
Yeah.